Well, hello, everyone. Thank you for joining us. First, I'd just like to say that my heart is with all of the Canadians who live every day on a regular basis with the experience of racism and discrimination. This isn't a new situation, and we have so much more to do, and we will continue to work together towards a country that ensures that everyone can live free of fear and with a fair chance to succeed. Comme il commence à faire beau.
We're beginning to see beautiful weather. We all look forward to the country getting back to a semblance of normal life.
Cases of COVID-19 across the country, even in areas that are larger, further away from large. So it's important to be careful and not to contribute to new cases. Please continue to wash your hands and stay 2 meters away from others. And if you cannot distance from others, please wear a mask. If you're feeling unwell, please stay home and contact public health if you have symptoms, even if they're mild. Officials are working at all levels of government together to lift restrictions as safely as possible. The Public Health Agency of Canada continues to publish guidelines in collaboration with chief public health officials, and the objective is to make sure that we are mitigating the risk of increased transmission due to lifting of some measures and monitoring closely the impacts of these changes. As measures are lifted, we need to make sure that the changes that are coming are not going to affect the disease activity in the regions. And as these changes are happening, I want to stress how important it is to remind ourselves that our actions today will have consequences on what a possible second wave of infection could look like. It feels scary and liberating right now, but we all have to remain watchful and continue to protect one another. From Canadians working from home to business owners closing shop or going online, we have seen people take extraordinary actions and make extraordinary sacrifices. So we can't lose the progress that we have made together. We cannot lower our guard. Things are getting better, but our families and communities are depending on us to keep working together to protect each other. Now I will turn to Dr. Tam, and then Dr. New, and then Minister McKenna. Dr. Tam.
Bonjour, good afternoon. I'll start with the latest numbers on COVID-19 in Canada. There are now 91,351 confirmed cases, including 7,305 deaths, and 49,235 cases, or 54%, have now recovered. Labs across Canada have tested over 1,691,000 people for COVID-19 to date, with about 5% of these testing positive overall. Over the past week, we have been testing an average of close to 29,000 people daily. While everyone in Canada is working hard in the fight against COVID-19, there is an increasing concern about a range of unintended consequences of the pandemic response, including for populations already experiencing marginalization due to stigma and other forms of discrimination. Among these unintended consequences is the impact on the ongoing public health crisis of opioid-related overdose deaths and problematic substance use in Canada more broadly. Last week, the British Columbia Coroner's Service reported that unintentional illicit drug toxicity deaths have increased in recent months, with over 100 reported deaths in the province, both in March and April 2020. This is a worrying trend, and it has been over a year since British Columbia observed numbers this high. There have also been spikes in opioid-related overdoses in Toronto and Calgary, and several jurisdictions, including Nova Scotia, Toronto, and Guelph, Ontario, have reported overdoses due to unknown or unusual mixes of toxic illicit substances. As it remains vital to keep up public health measures to protect all Canadians from COVID-19, we must find ways to maintain life-saving supports, including treatment and harm reduction services for loved ones and members of our communities who use drugs. Changes in the illegal drug supply in the wake of COVID-19 may result in increased risk of overdose for persons who use drugs. We know that using drugs alone is a major risk factor for experiencing a fatal overdose. This is why it is so important never to use drugs alone. Always have someone nearby or connected virtually to someone who can monitor you and be ready to call 911 or your local emergency helpline if needed. It is encouraging to see community organizations and governments across the country coming together to address the dual public health crises of COVID-19 and drug overdose deaths. Harm reduction and treatment facilities are implementing infection controls and ramping up virtual and mobile services. The Government of Canada's Wellness Together portal provides wellness and substance use resources free to all Canadians. British Columbia's Lifeguard app will automatically contact 911 if you don't click in within 75 seconds of taking a drug. Stella Circle in Newfoundland and Labrador is providing clients with technology and Wi-Fi to access online tools. Other organizations are providing adequate housing, meals, and improving access to medications for substance use disorders to minimize drug-related harms and the impacts of COVID-19. It is efforts like these that will help minimize the inequitable and disproportionate effect of the pandemic on an already vulnerable group of Canadians. Together, we can reduce drug-related harms while keeping up with the essential public health measures to reduce the impact of COVID-19. Thank you. Merci.
Bonjour. Je vais commencer.
Good afternoon. I'll start with the latest numbers on COVID-19 in Canada. There are now 91,351 confirmed cases, including 7,305 deaths and 49,335 people recovered, 54% of cases. Laboratories across Canada have tested over 1,691,373 people for COVID-19 to date, with about 5% of these testing positive overall. Over the past week, we have been testing an average of 29,000 people daily. While everyone in Canada is working hard in the fight against COVID-19, there is an increasing concern about a range of unintended consequences of the pandemic response, including for populations already experiencing marginalization due to stigma and other forms of discrimination. Among these unintended consequences is the impact on the ongoing public health crisis of opioid-related overdose deaths and problematic substance use in Canada more broadly. Last week, the British Columbia Coroner Service reported that unintentional illicit drug toxicity deaths have increased in recent months, with over 100 reported deaths in the province in both March and April 2020. This is a worrying trend, as it has been over a year since British Columbia observed numbers this high sustained over a 2-month period. There have also been spikes in opioid-related overdoses in Toronto and Calgary, and several jurisdictions, including Nova Scotia, Toronto, and Guelph, Ontario, have reported overdoses due to unknown and unusual mixes of toxic illicit substances. As it remains vital to keep up public health measures to protect all Canadians from COVID-19, we must find ways to maintain life-saving support, including treatment and harm reduction services for loved ones and members of our communities who use drugs. Changes in the illegal drug supply in the wake of COVID-19 may result in increased risk of overdose for persons who use drugs. We know that using drugs alone is a major risk factor for experiencing a fatal overdose. This is why it is so important never to use drugs alone. Always have someone nearby or connect virtually to someone who can monitor you and be ready to call 911 or your local emergency helpline if needed. Organizations and orders of government across the country coming together to address the dual public health crisis of COVID-19 and drug overdose deaths. Harm reduction and treatment facilities are implementing infection controls and ramping up virtual and mobile services. The Government of Canada's Wellness Together portal provides wellness and substance use resources free to all Canadians. British Columbia's Lifeguard app will automatically contact 911 if you don't click in within 75 seconds of taking a drug. Stella Circle in Newfoundland and Labrador is providing clients with technology and Wi-Fi to access online tools. Other organizations are providing adequate housing, meals, and improving access to medications for substance use disorders to related harms and the impact of COVID-19. It is efforts like these that will help minimize the inequitable and disproportionate effect of the pandemic on an already vulnerable group of Canadians. Together, we can reduce drug-related harms while keeping up with essential public health measures to reduce the impact of COVID-19. Thank you.
Thank you very much. I want to start by reiterating Minister Hadji's comments. We're watching hundreds of thousands or millions marching around the world and in Canada for human rights. Let's be clear, Canada is not immune to racism and discrimination. We all need to work together to call it out and to do better. The health and well-being of Canadians has been and will continue to be the top priority of our government. But this pandemic has affected a lot more than personal health. It also has affected our economy, which is why our government has been taking decisive action to support families, businesses, and communities, and it's why we're looking ahead to see what more can be done. On peut notamment aider en
We can help by continue developing infrastructure projects throughout the country. For example, electric buses, renewable energies, and water projects that will help create good jobs and help communities to get back on their feet.
Understands the challenging situation that cities or towns are in. I have spoken with mayors from across the country, and I've heard about their significant COVID-related financial pressures, in particular in relation to public transit. Our government is having important conversations with provinces and territories about this pressing issue. As the Prime Minister said earlier today, today's announcement is a start. We know that more help is needed for municipalities, but every voyage begins with a first step. To make sure cities and towns have the resources they need to get and keep infrastructure projects going, we're speeding up this year's funding delivered through the Federal Gas Tax Fund. Instead of delivering two payments, one in the summer and one later in the year, we're delivering the full 2020-2021 amount to communities this month. Our government recognizes the need to be flexible during this crisis. By getting this money out early, we are contributing to a safe restart, helping communities get back on their feet, supporting them to get more infrastructure built, like high-speed broadband, public transit and wastewater, creating jobs, and building a stronger, cleaner, healthier, and more connected country. For
communities to have the resources they need to launch their economy and follow up projects, and as the Prime Minister announced this morning, we are accelerating this year's fund through the Gas Tax Fund. Instead of two installments, one in the summer and one later in the year, we will be providing the entire amount to municipalities in June. This is one step to help municipalities. The government recognizes the need for flexibility during this crisis. By quickly disbursing municipal funds, we are ensuring that there's a sure recovery, helping municipalities to get back on their feet, helping them create new infrastructure like broadband infrastructure, public transit, and wastewater treatment projects, helping them to create jobs and to create a more connected and stronger economy.
Provides $2.2 billion to cities and towns and First Nation communities and supports thousands of local infrastructure projects. Projects like the 1,550 solar panels installed in the district of Hudson's Hope in British Columbia, improvements to the Legacy Trail between Canmore and Banff, the rehabilitation of the Sid Buckwold Bridge in Saskatoon. Dollars from this fund are helping with pool upgrades in the St. James Civic Center in Winnipeg and with stormwater management in Mississauga. Ces fonds ont permis d'électrifier.
These funds have helped to electrify buses in Laval and funded recharge stations in New Brunswick.
Be used immediately by municipalities for priority projects. It can be banked for later use, pooled with other communities for shared infrastructure projects, or used to help finance big-ticket projects that can pay community dividends for decades to come. Alors que nous sommes confrontés au plus.
While we are facing the greatest health and social economic challenges in our country, more municipalities in the country will be able to take investment decisions to invest in the projects they need, investments that will help them strengthen municipalities during this pandemic and help build cleaner, healthier, stronger, and more connected municipalities.
Accelerated federal gas tax fund payment is just one way we are showing flexibility in response to the pandemic, helping Canadians and their communities adapt and recover, get people working, and building a stronger, cleaner, healthier, and more connected country for the future. As the Prime Minister said this morning, this is a start. We know there's more to be done to support municipalities, so we'll keep working with the provinces and territories with more to come. Thank you.
Thank you, Minister. We will now start taking questions. As usual, we'll start on the phone, 3 questions, and then we'll turn to the room. 1 question, 1 follow-up. Operator, over to you.
Thank you. Our first question, notre première question is from Crystal Oak from Global News. Please go ahead. À vous la parole.
Hi, my question is for Dr. Tam. Has any progress been made on gathering more detailed data, for example, about race or immigration status on people suffering from COVID-19? You've acknowledged that there are gaps in the data, but I'd like to ask what is being done to address those gaps.
Yes, that's an important question, and we have, on the general set of data, things have improved, and so we now have like 99% of the case report form from provinces and territories. Unfortunately, they don't currently contain the race and ethnicity information. So we're working really right now with Statistics Canada and other organizations like CIHI and the provinces and territories really actively to try and get some of that. Having said that, it'd be no surprise to anyone just based on the information already available, not necessarily through this systematic data gathering, that those who are in certain more disadvantaged populations, socioeconomic areas of lower socioeconomic sort of levels, and certain groups of people in Canada are more vulnerable to the impact of COVID-19, and that's already evident.
Thank you. And for a follow-up, so how significant are these social determinants? I know you're saying that you're not having the data, but do you have a timeline on when we would get that data and how significant those would be?
So we are working with mainly Statistics Canada, for example, in looking at linkages and looking at trends to not just the COVID-19, but seeing what kind of data is available on the unintended consequences and the other data linkages. So I think that's actually really important. But as you've also seen from the more granular data provided now from areas like Toronto, we know in areas like Montreal, there are certain areas of even down to the local jurisdiction that are seeing disproportionate number of cases. Some of them are related to the work that people living in those areas are linked to, such as some of the workplaces that we've seen outbreaks in, but also crowded living conditions. So that data is coming out from more the local level.
Thank you.
Thank you, Doctor. Operator, next question, please.
Thank you. Our next question, notre prochaine question is from Marie-Vestelle avec Le Devoir. Please go ahead. À vous la parole.
Question. Hello, my question is for Minister McKenna on today's announcement. I would like to know the gas tax fund for municipalities, will there be an exception? Will the cities be able to spend this money on anything else besides infrastructure, if they so will? Answer. Thank you very much for the question. The fund is intended to help with capital costs for municipalities. It does not necessarily mean that the entire fund should be invested this year. They could keep the funds to invest in major infrastructure projects in the future. They could work with other municipalities. It's not for operational costs, it's for capital expenses. Answer. Supplementary question. Still on infrastructure, and still for you, Minister McKenna, we are hearing that there are negotiations on the way between Quebec and your department to see if there are ways of speeding up infrastructure spending and to see if Ottawa could offer Quebec more flexibility for the use of these federal funds more quickly for some projects like schools and hospitals. Could you tell us what the state of these negotiations are with Quebec? Are there any developments? Is there an agreement? Answer. I am having lots of discussions with my counterparts throughout the country. We are hearing them. Certainly, we need to be flexible. We need to find out what is necessary now and in the future in the area of infrastructure, of course. Discussions will continue. When there's something to report, I will be here to report. Of course, I'm working very well with Minister Dubé.
Thank you. Merci. Our next question, notre prochaine question is from Jim Bronsko, the Canadian Press. Please go ahead. À vous la parole.
Good morning. Will you commit to consulting with the Privacy Commissioner on any plan for a national contact tracing app?
Thank you very much. We know that privacy is of utmost importance to Canadians, and so the work is ongoing right now to look at a variety of different options that has privacy at the first and foremost consideration. As the Minister of Health, of course, having a digital contact tracing app would likely be helpful for some jurisdictions, but we also know that an enormous amount of contact tracing is happening in the old-fashioned way using human beings. In fact, some jurisdictions prefer it that way, and so we are continuing those conversations with our colleagues, and I know the Prime Minister himself is watching this development very carefully, as it is of utmost importance to him as well.
Jim, follow up.
How concerned are you about an uptick in the cases of COVID-19, spread of the coronavirus through the street protests that are unfolding now?
I'll answer generally, and then I'll turn to Dr. Tam for some practical protest advice. Listen, I think it's people's right to express their support and in some cases concern about things that are unfolding both here in our country and across the world. And we know that gathering together is a very powerful way to lend that support and to be an ally in many of these kinds of situations. There are ways to do it more safely. People still do need to keep physical distance, make sure that they bring with them hand sanitizer, for example, and I think bring a mask. There are situations change very quickly when you're in a crowd setting, and you may not be able to keep that physical distance from someone else. So I think although we've seen much more peaceful protests in general here in Canada, we still encourage people to be very careful when they're congregating in large crowds. as you recall, was one of the first things that many municipalities and provincial governments chose to limit was the size of crowds gathering, and there's a reason for that. It's much easier to come into contact with other people's droplets when you're close by. Dr. Tam, did you want to add anything?
I think that, as in any gatherings, follow your local public health advice, but doing it as safely as possible, I think, is the key from a health perspective. So I think, as the minister said, try to maintain that physical distance, but one might sort of perceive that this could be difficult to maintain. So definitely wearing a mask, having hand sanitizers, or having access to hand washing will be very important. One thing to consider is that, of course, wearing a mask is important, but shouting and making really loud sort of projections can potentially increase the risk. And so, I might want to choose other means of showing or messaging, whether it's be signage or making noise using other instruments, for example. It's just to consider that shouting and that type of behavior can potentially project more droplets. But be considerate of others. I think people are out to protest, to support a common goal. So I think being respectful and kind to each other who is participating by wearing masks and doing the right public health measures, I think is really key. I do think that local public health will be monitoring very closely because I think protests outdoors will have low risk, but anything that's more in an enclosed environment with lots of people are the things that local public health will be most concerned about in terms of COVID-19 spread.
Thank you, Doctor. We'll now turn to the room. So, Mackenzie.
Hi, everyone. Mackenzie Gray, CTV News. I'd like to start with you, Mr. Haidu. In your answer about contact tracing to Jim's question earlier, you seemed to kind of bring up that municipalities and other agencies might be interested in sticking with the old-fashioned way. The Prime Minister a few weeks ago seemed very confident that it'd be a singular app that the government would basically tell people to download if they were feeling comfortable with that. Is that still the plan of the government?
I think whatever path that we choose to go forward with a digital app for contact tracing, it has to be an app that Canadians will feel comfortable using and that we can gain momentum with. One of the things that I think from a health perspective we're keeping our eye on is the usefulness of an app if there's not a high take-up. And actually the success of the apps require people to want to use them. And so we are right now having conversations with provinces and territories. There are, as you know, some apps being used in other provinces that provinces feel are very effective or becoming effective, if you will, in their own domain. And those are the conversations underway. But listen, everything we've done so far has been in collaboration with the provinces and territories. It's important to make sure that we have an approach that Canadians are comfortable with and that they will use.
My follow-up is from Minister McKenna on the gas tax announcement today. Basically, this seems like just a cash advance for many of the cities. They're going to be getting money that they would have received earlier. You talked to a number of mayors, Kennedy Stewart and Vancouver being one of them, saying, we need money now. We're going to have to lay people off. In Toronto, the TTC needs a lot of money to be able to continue to run. Why is the federal government giving money for infrastructure projects and not for operational costs like paying people to make sure they don't get laid off and keeping important services like public transit going?
So I've had many conversations with mayors across the country, and just today with Mayor Kennedy Stewart, as you said, as well as Mayor Tory, Mayor Watson. And this is a first step. The Prime Minister has been clear. We do need municipalities to go ahead with their planned infrastructure projects, and that includes in relation to public transit. But of course, we recognize that there are bigger challenges. I've certainly heard directly about the impacts of decline in revenue when it comes to public transportation, and we need to restart properly. We do need people to be able to take public transit, and people are taking it right now, are essential workers, and they need to be able to do it in a safe way. So we are having these conversations. that we do need to be working with provinces. Provinces have prime responsibility for operating costs, and we're having those conversations right now. I've had conversations with my provincial counterparts, and I certainly, like our government, was heartened to see Premier Ford say he recognizes that the provinces will need to step up, and we're certainly working with them. But we recognize that we need to do more.
Thank you, Minister. I will now go back to the phone. Operator, over to you.
Thank you. Merci. Our next question is from Lena Dibb avec la presse canadienne. Please go ahead. À vous la parole.
Oui, bonjour.
Question. Hi, Mrs. McKenna. Why the delay to reach an agreement with the municipalities, knowing that they've been asking for 10 billion for the past 2 months? Why the delay in the negotiations? Answer. I think it's a very important measure. It's true, it's not everything. We want the municipalities to start with infrastructure projects planned. We are having lots of discussions. I'm talking with the mayors throughout the country. It's sure that they need help for operational costs, including public transit. It's very important that we have public transit now for essential workers to be able to go to work and for economy to reopen. But we are respecting jurisdictions. Municipalities fall under the provincial jurisdiction. We are not saying we are not going to help. We already took this important measure this morning. We hope that the provinces will step up and join us to help the municipalities that need help because of the COVID-19 situation. Follow-up question? I understood that. I'm trying to find out if you could provide details as to why you haven't reached an agreement with the provinces to help municipalities to give them money for operational costs. Answer. I know that many discussions are underway between the Prime Minister, Minister Freeland, with the provinces and territories. I think every week they have discussions. They are continuing. And these are important discussions. As I said, we've not arrived at an agreement, but we do hope that some provinces will recognize the fact that we need to work together to help municipalities.
Operator, one last question, please.
Thank you. Merci. Our last question is from Bill Curry with the Globe and Mail. Please go ahead. À vous la parole.
Thanks. For Minister McKenna, earlier this year you put out a report saying that the government had identified about 52,000 infrastructure projects and funded them. And yet the parliamentary budget officer was at committee on Friday saying that he can only find 33,000 and he doesn't know where the missing 20,000 are. So can you explain that or address his concern?
Thanks for the question. Look, we've been working hard to invest in infrastructure, and this infrastructure is having a huge impact on lives across the country, whether it's investments in public transportation, in wastewater, and community and rec centers. These are really important initiatives. We have projects that the Auditor General spoke about, 33,000 that are through our infrastructure program. There are also projects that are through the gas tax that we're announcing today, and there are also projects through CMHC. That brings up to the total of projects, and we're going to continue moving forward. This announcement today is an example of how we see infrastructure is critical to the restart of the economy, but also in the longer term, it's about ensuring that we have a healthier, cleaner, and more connected country.
Bill, follow up.
And on today's announcement, you and the Prime Minister said that further promises are dependent on talks with the provinces. But just last year, the federal government, without the provinces, doubled the gas tax to $4.4 billion for that 1 year only. So why not just do something similar this time, increase the gas tax, which is something the federal government can do without the provinces?
Look, we're making not only today's announcement, but we've been investing in infrastructure with municipalities, and we've taken a whole range of measures already in the last few months to support Canadians, to support Canadian businesses, to support Canadian individuals, to support provinces, and we're going to continue to do that. But let's be clear, by provinces are creatures of the provinces. And so we really do need the provinces to work together. We certainly understand the significant challenges that are faced by cities and towns across revenues for public transit. And we're going to continue working with the provinces. I think a solution is there to be had. And as I say, I've seen, Premier Ford has been clear. He recognizes the need to step up. And I think this is where we need to show to Canadians that the federal government and the province can work together to support cities as we go forward.
Merci, Madame la Ministre. Ceci met fin à la conférence de presse. That's it for today. Thank you.
That's the end of today's press conference.